So we are now starting the fascia of neck. This is deep fascia. After removing the skin, there is superficial fascia and then deep fascia. Remember one point. It is deep fascia of neck. There is no deep fascia. There is no deep fascia in face. फेस पे कोई डीप फेशिया नहीं है except some region and like parotid gland just other parts has no deep fascia. There is no deep fascia in face except exception is at parotid gland. Just parotid gland पे fascia, then there is no deep fascia in the face. Hmm? So this is deep fascia of neck. So in neck, remember now first we draw a diagram to understand. So let's say this is our head and head region. Let's say this is our head region. This is head. This is eye. And just a drawing. So in neck region, this fascia is present like this. Let's say this is the vertebral column. This is the vertebral column. Hmm. This is vertebral column. Done. So in neck region, this fascia is present like this. It connect above to the skull and then it descend. This deep fascia descend to the sternum in front and in back it descend down. So this deep fascia is present like this. Up to the this deep fascia is present up to the region of scapula. Descend down up to the scapula. So we draw here is scapula. The angular blade of the scapula. Below this there is no deep fascia. So it is like cover. So it is the cover of the neck. This is angle of scapula. Basically spine angle. Blade. So shoulder blade. Angle spine बोल सकते हैं. This is spine. Spine be upper side, upper surface. Upper surface of spine in scapula. Done. And here is sternum. Sternum manubrium. Manubrium. So these are the anterior and posterior attachment in lower end. And the lateral attachment, this deep fascia is like this. Cover. Both sides it cover like this. Done. So this cover is called the deep fascia of the neck. This is deep fascia. Cover the all structures of the neck, basically arteries, nerves, vertebra, and many things. This is the deep fascia of the neck which cover the structures below the skin and muscles. Done. So it has upper attachment like this and has lower attachment. So there are many points, many attachments. So first we draw the upper attachment and then lower attachment. So here upper, wait, attachments. Attachments of deep fascia. Basically two attachments are upper and lower. So first there is upper. Upper may be anteriorly, posteriorly, many things. So for upper attachment, we draw a diagram of skull. Let's say this is the diagram of the skull. Here is orbit, then this is nose area. Then here is this is mandible, and here is teeth. Then here is tympanic canal, and this is mastoid process. So this is our skull. This is skull. So upper attachment above and below. Remember, behind the on the occipital region of the skull, there is a protuberance which is marked prominence, which is called protuberance. This is called occipital protuberance. This is called occipital protuberance. Occipital protuberance. This region is like this. We can draw from the posterior side. This is the external occipital protuberance, and here is a line ascend. Here is a line go laterally above region. This is called superior nuchal line. Nuchal line, and here is below this there is a inferior nuchal line. Nuchal line. This is the occipital region of the skull. From behind. These are the behind this portion. It has one protuberance called occipital protuberance. This is called occipital protuberance. Yeah, this is. So these are the three things present on the occipital posterior region of the skull. So this fascia attached to the this fascia attached like this. Occipital protuberance, then superior nuchal line. From here it turns up to the mastoid process. This is the mastoid process in the skull. Here we can draw. Wait, this is the view. This is our skull. So here this is the occipital protuberance. From here it descend to the mastoid process. This is the we can draw from occipital protuberance and the superior nuchal line. This deep fascia extend to the mastoid process here. Then it descends to the angle of the mandible. This is the angle of mandible. Hmm. This is the attachment, upper attachment of the deep fascia. Up to the from it start to the occipital protuberance, then superior nuchal line, which is laterally slightly this, then this line deep descend down up to the mastoid process. Then this jump to the angle of the mandible. Then this is the base of the mandible. It reaches to the symphysis mentis, and this is turned up to the other side like this. This is the other side of the attachment of this fascia. Similar pattern. This is the similar pattern of on the other side. Then this join and form the complete ring. This is the attachment of the deep fascia. First, occipital protuberance, superior nuchal line, nuchal line, mastoid process, and then this is the angle of mandible, angle of mandible. This is mastoid process. Here is superior nuchal line. This is the superior nuchal line. This is base of mandible. This is symphysis mentis. Just tip. So these are the attachment, upper attachment of the deep fascia. Then come to the lower attachment. These are upper attachment. Then come to the lower attachment. Lower में this is like in front. Let's say this is the front region. So here this is the sternum manubrium. Then lateral to sternum, we know there is a clavicle. Then it is attached to the clavicle. Then there is acromion joint. We know. Then from acromion joint, it go to the spine of the scapula, and from here it turns and then rotate around the neck like this. So we draw a diagram for this. This is the manubrium. From here, this is clavicle. Then here is acromion joint, acromion process of scapula, which is go behind. This is the behind portion. Then this is the spine of the scapula, above surface. So these are the attachment basically. It start to the sternum manubrium. First it attach to the sternum manubrium. Then it go to the clavicle. Then it go to the acromion process, acromion joint. Then spine of scapula, and then again rotate to complete this ring. So here attachments are, we can write, this is manubrium, then clavicle, upper surface, clavicle superior surface, superior surface, then acromion joint, acromion process, Mium process, then spine of scapula, and then it rotates to complete the circle. So these are the lower attachment of the deep fascia. Done. So now let's move to the transition. So this deep fascia is has not only single fascia, it has many parts, constituents. So this deep fascia divided into many parts. Parts of deep fascia. So it has four parts. Number one, it is divided into four parts. First is investing layer. This these all are the deep fascia, but there are different parts divided. Investing layer, outer investing layer, investing outer layer. This is the most outermost layer. We draw this is the cover of the, so this whole is the investing layer of the deep fascia. It again and another inside there are many parts which cover many parts of the deep fascia which cover the important structures. All there are parts of the deep fascia. The whole constituent the deep fascia. All constituent, all parts milake complete. All parts form the complete deep fascia. Another is carotid sheath. Carotid sheath. Then prevertebral, vertebral, pretracheal, fascia, and the last is buccopharengeal. Buccopharyngeal fascia. All are fascia. Whole constituent the deep fascia. Done. So first is investing layer. So it is the outermost layer, and all attached and all are the upper and lower attachment are the layer investing layer attachment. Remember, these are the attachments of the investing layer. Basically, deep fascia to all hai na. These all are the deep fascia. So there are many layers. So these are the attachments of the investing layer. So we can write here these are investing layer attachment parts. में divide करते हैं ना. First part is the A part, investing layer, deep fascia. Done. These are the deep fascia attachments. So first we draw a transaction to show all these fascias. So first we know there is a back vertebral present vertebra. This is the vertebra. Hmm? And here has many muscles. There are many muscles attached to it. Yes. First we draw. fascias. One fascia surrounding this पहले स्ट्रक्चर जोड़ देते हैं. There is muscle present. So one muscle is like this. This is the first muscle. This is second, and this is the third muscle. There are muscles present here. These are three muscles, and here then there are many important structures between these muscles. So this is the vertebra, and there are muscles. These are scalenus muscle. All are scalenus. Anterior, posterior, and middle. Scalenus muscle. This is anterior. This is middle, and this is posterior. These are scalenus muscle. Anterior, middle, and posterior. The structures present between them. Here is nerve and artery. This is the point where subclavian artery present, and there are many nerves of the brachial plexus. The brachial plexus nerve passes between the anterior and middle scalenus muscle. Then these are the brachial plexus nerve. Wait. Muscle. इसको रिमूव कर दिया. These are scalenus muscle. Then in front of this there is a nerve called phrenic nerve. This is the phrenic nerve. These are brachial plexus nerves, and all these structures are covered by fascia called prevertebral fascia. This is the prevertebral fascia. Then here we know in front of this there is pharynx or esophagus. Done. So this pharynx is covered by another fascia called buccopharengeal fascia. Then in front of this there is a one important thing which is called trachea. This is the trachea. We know this is the trachea. In front of trachea there is a fascia called pretracheal fascia. Then this is the prevertebral, buccopharyngeal, and pretracheal. So it has two layers. First important thing, there is a gland present here, and we know the name of this gland. The gland in front of trachea in neck, the one important gland is which is called thyroid gland, and some muscles also. We draw here muscles. These are muscles. So it has two parts. Pretracheal fascia has two parts. One for muscle and one for gland. Done. So all these structures are covered by pretracheal fascia. These structures, not trachea, because pretrachea in front of trachea. Then And one last, second last, we know in the neck region there is an artery called carotid artery, and one nerve is vagus nerve which go deep down, and another is vein which is called internal jugular vein. All these are important things which is present on both sides. Then, so these are the things. All these are, this is the carotid artery. So the fascia which cover the this artery is called pretracheal artery. Sorry, carotid sheath. The fascia cover this carotid sheath. So whole the structures are covered. Now first we name it. Naming is important. First naming is important. Wait. Then we draw the last thing. Naming कर लेते हैं पहले इसकी. These are the muscles. Muscles. Basically, which muscle? The outer is, wait, differently लिख लेते हैं. The outer and inner muscle. There are two muscles, na? The outer is, remember, these are two muscles. The outer which go more above, and the lower, the inner muscle is which is more inferior. The outer muscle go more superior. So we know these are the muscles sternothyroid and sternohyoid. These are the two muscles. So which is the more superior? Thyroid gland, thyroid cartilage, or hyoid bone? Which is more superior? We know the hyoid bone is more superior, just below the tongue. So the outer is thyrohyoid, and the below, and the sternohyoid, and the lower is which is more inferior, which is called sternothyroid. This is sternothyroid, and this is sternothyroid, because it is go only the up to the thyroid gland, thyroid cartilage, and it go to the hyoid bone. From both are the from starting from the sternum, sternothyroid and sternohyoid. Then, and this is the thyroid gland. This is trachea, and this is the carotid canal. First, we named this fascia. All these structures covered by these structures. Orange color से mark कर रहे हैं fascia को. This is called pretracheal fascia. Then trachea is not covered. Next is pharynx, pharynx, and it is covered by basically pharynx and esophagus. All these we can write this the esophagus, not write pharynx, because after division we can write esophagus. Esophagus. Then it is covered by buccopharyngeal fascia. Buccopharyngeal fascia. Done. Then this is the carotid sheath. Important thing. Naming. First, name. This is internal jugular vein. This is This is vagus nerve, and this is internal carotid and or also common carotid. Internal carotid after division of carotid external and internal, and if because it go down up to the arch of the aorta, so it can be common carotid. First we draw the internal carotid, but it may be common carotid also if we take the section lower region, just above the arch of aorta, internal carotid artery. All these are covered by carotid sheath, artery or common carotid. Then then another is prevertebral artery, prevertebral fascia. First we name the structures. This is scalenus anterior. This is scalenus this scalenus medius. This is scalenus scalenus posterior. Done. And these are the important things. Another brachial plexus nerves, brachial plexus. This is subclavian artery, subclavian artery, and this is these are this is vagus nerve. We name it different. Sorry, phrenic nerve. This is phrenic nerve. Nerve. Done. So this is the name. Now again we draw the investing layer. So these are the different parts, but we don't have draw the investing layer. So first all these structures covered by pretracheal fascia. Then another is we draw the deep fascia. Sorry, investing layer. The last. We draw the investing layer only one side, but this is it complete the circle. It start, then it divides into two parts to cover the muscle. Then again it continue behind and here in behind it cover the again another muscle. Then it continue again. Here it again cover this this muscle, and then it continue the circle. There are four muscles covered. The muscle covered here is this is trapezius muscle. Remember, trapezius muscle is present in both sides, so it covers the trapezius in both sides. This is trapezius muscle. Trapezius muscle, and here this is the another muscle here present between this layer. This muscle is called sternocleidomastoid. Sternocleidomastoid muscle, or it has another name, complete name. We write complete name sternocleido occipito, also sometimes include occipito, because it is attached to the occipital also. Occipital. Done. So this is the complete name of this muscle, sternocleido-occipito-mastoid muscle. So this is the investing layer. This whole is investing layer, which cover the all structures. All these fascia are internal to and deep to the investing layer. This is investing layer. Then we draw only one side, but this is present in both sides. Remember, it completes the circle like this. Here, these are the namings, labeling of diagram. Done. So this is the transaction of the all fascias. Now we go to the investing layer. We have done the attachments and some spaces covered by it, spaces and glands. So first, glands covered by the investing layer. Investing layer. First, it covers the glands. It covers two glands. One is parotid, and the another is submandibular. Submandibular. Basically, these are the salivary glands. Done. So how it covers? First, we take section of mandibular. Remember, it is present near to the base of the mandible. So from the base of the mandible, this is the region where the submandibular gland present. Let's say we draw a diagram here. This is the mandible. Mandibular. This is the mandible. So here is submandibular gland present. Here, this region is the submandibular gland present here, below mandible. So it covered like this. Let's say we draw a section, different section for this. Let's say this is the one section of the mandible. On mandible, we have tooth. Then this is the sagittal section. Sagittal section. Here is submandibular gland present. This is the submandibular gland, and there is fascia present which cover it from the both sides. One is inner layer and the one is outer layer. Done. Hmm. At the joint and go to the hyoid bone. Here is the hyoid bone. This is hyoid bone. This is mandible. This is submandibular gland. Mandibular gland. And this is investing layer. Investing layer. Investing layer को difference भी देते हैं. This is investing layer. It has one superficial layer and one is deep layer. Done. So these are the parotid. These are the covering of the mandibular gland, submandibular gland. How it cover the submandibular gland? Cover. Done. Now come to the parotid gland. So for parotid gland, done. This is the image. So for parotid gland, So here is our parotid gland present. This is the region where the parotid gland present. This is the region where the parotid gland present. Done. So now it has two layers. One is superficial layer. It is attached to the this zygomatic process. This the this is the zygomatic arch. One layer is attached to this to cover this, and the one layer attached to the deep layer is attached to the tympanic membrane. Cover this. Then this cover the parotid gland, and there is one ligament formed which is formed by thickening of this layer, which is called, we know there is a styloid process here. Done. So from styloid process to the mandible, this is called, which is called the stylomandibular ligament, which is formed by thickening of the investing layer. So remember, here is what we have seen, parot to cover parotid gland. For parotid gland, two layers 2m, two layers present. The one is superficial, attached to the which process? Zygomatic process. This is the zygomatic process. Zygomatic process. This is zygomatic process of temporal bone. This is a similar fashion in the like orbit margin. This is the temporal bone which is facing towards the zygomatic bone. So it is the zygomatic process of temporal bone, and this is the temporal process of zygomatic bone. So this is the zygomatic process. One layer is attached to the zygomatic process, superficial, and the deep layer is attached to the tympanic canal. This is the tympanic canal. This is the womb, which is external auditory canal, tympanic canal, ear canal, external auditory meatus, tympanic canal. Then we external auditory meatus, auditory canal, auditory canal. Then this is the deep layer. Deep layer is auditory canal. Auditory canal, basically tympanic part. We can say tympanic part of temporal bone. You can write tympanic part. Tympanic part and auditory canal. This region is called tympanic part and tympanic part of temporal bone. Here we can write and auditory, because we know it cannot go to the deep to the auditory canal. Just it is the outer opening. It is attached to the outer opening of the auditory canal and tympanic part of temporal. Then then there is a ligament formed. A ligament, we can write ligament formed called stylo stylomandibular mandibular ligament. This is the styloid process. Wait, this is the styloid process. From tip of the styloid process, a ligament formed which is formed by thickening of the investing layer to the angle of the mandible. This is styloid process. Styloid process. Styloid process. Done. This is styloid process. Done. And this ligament. Below this ligament, there is a gland we have read the submandibular gland. This is the submandibular gland. So this ligament separates the submandibular and parotid gland. This is submandibular gland. You can write name. This is parotid gland. Parotid gland. And this is submandibular mandibular gland. So here these two glands cover. Now come to the deep area. So these two glands are covered by this A point. It covers the two spaces also. Spaces. So first there are two spaces formed. One space is at the suprasternal space. So first we draw a diagram. Let's say this is the manubrium process. Manubrium again. And here is clavicle attached. This is the clavicle. Both sides. Done. Remember the investing layer go and now it divide again into two and form the spaces like this. If we take the sagittal section, so this is like one is up, 1 and 2. This is the sagittal section of manubrium. So we can say this is superficial layer, and this is deep layer. This sagittal section. So here it again deep down this layer and form like this. One is superficial layer and below and posteriorly more there is a deep layer. So here there is a content of this fascia. This fascia. First is the ligament which connect the two clavicle to the and around. This is called the interclavicular ligament. Done. Then another thing we know the muscle. Here is important muscle attached. This muscle is called sternocleidomastoid. It again has two heads. This muscle has two heads. The one is clavicular head and the one is the first head is clavicular and the one is sternal head. This is the sternocleidomastoid muscle. So for second content is sternal head of the sternocleidomastoid. One content is interclavicular ligament and the third is, remember here, deep to this muscle there is a vein present called internal jugular vein. Both sides, deep to this muscle. So these veins are connected by a communicating vein which is called interjugular connection, interjugular vein. Done. So first naming कर लेते हैं इसकी purpose. These are internal jugular vein, both side, and connected by interjugular connection. Then we can write here, this is interjugular vein. Interjugular vein. Remember, this is the connection between two internal jugular vein. We can write this is connection between two internal jugular vein. Internal jugular vein. Done. And this is the, we can write sternal head. Sternal head of sternocleidomastoid. This is the muscle attached below to the clavicle and sternum, and then it ascends to the occipital region, mastoid process, and occipital and styloid process. Styloid process means mastoid process. Cleidomastoid. Then this is the muscle called sternocleidomastoid. It is attached to the mastoid process, then occipital region, and here is clavicle and sternum. Then, and this is called inter ligament, interclavicular ligament. This is interclavicular ligament. So here is the name of this guy. This is the sagittal section of this. Done. So this is the first space covered by the investing layer. This space is called, we can write, this space is called supraclavicular space, also called burn space. Just name it. Done. So content of this space is interjugular connection. We can write. Then this is the content. One, this is content. This is content. And this is content. All these are contents. These are contents of this space. Done. Now come to the another space. This first. The second is second space is supraclavicular ligament. Supra sternal space. Sorry, this is suprasternal. Suprasternal, because this is just above the sternum, na? So this is called suprasternal. Then come to the another space which is called supraclavicular space, where it present between present at middle one third of clavicle. Clavicle के middle one third पे is just a space. Done. It was present between. So it is this space is like this. We draw the clavicle. We draw sagittal section. This is the clavicle, and here is a muscle present up just front of clavicle. This ka pectoralis major muscle. Remember. Done. Again, this layer is descend and divide into two and form the layers. This is the outer region, this is the inner region. So one thing is go inner to it and one thing is go outer to it. Done. So here we know there is a subclavian vein. There is a subclavian vein. So external jugular vein pierce it and then drain into the subclavian vein. This is the external jugular vein. And the one thing is which go outside to it. This is called supraclavicular nerve. This is supraclavicular nerve. Go outside. Done. This is external jugular vein. Go inside. This is inside. This is going inside. Done. So this is the supraclavicular space just above the clavicle. Let's say this is the clavicle. Done. This is the clavicle. So this is the space. This is supraclavicular space. Space. Done. So it is like this. This is the sagittal section. So we can write content, and the most important thing is the main content of this fascia is fat. Here is fat present also. This is the fat also. So we can write in content. This is content. This is content. And this is content. So clinical is, here is clinical. Any, remember one thing. The jugular vein is piercing this fascia and go inside. So this fascia is just attached to the walls of the vein. Again, this is the similar pattern we have learned in previous scalp layer. The emissary veins in connective tissue. This layer is prevent the retracting of the external jugular vein if any injury occur. So this vessel cannot be more easily closed. So there is bleeding continuously occur. any injury lead to continuous bleeding, continuously continuous bleeding because of no closing of external jugular vein, external jugular vein, external jugular vein because of the reason of, because this is not closed due to fascia, investing layer, investing fascia. It prevent retraction of the vessel, prevent retraction, prevent retraction of vein. So this is the cleaning point. So any injury, any suppose is knife लग गया इस area में, so any attack, this can cause continuous bleeding. Done. So two muscles, two spaces are covered by this. Two ligaments. So we can write the things. Third point is, so we can write all these things. Structures covered by investing layer. Done. All are 2 2. First is muscle. Two muscles हैं, which is sternocleidomastoid, sternocleidomastoid. We have seen investing layer covered sternocleidomastoid, and the one is trapezius. Another is two spaces spaces also two, supra clavicular and suprasternal. Two ligaments, sorry, two glands. First important, glands. Two glands. Which gland? Which two gland? We can write the carotid, and another is submandibular. The fourth is two spaces, ligaments. Ligaments to include, first is stylomandibular, one is stylomandibular and sphenomandibular. We have not seen the sphenomandibular, this is we cover later. Sphenomandibular, mandibular, and the last, the two pulleys, two muscle pulleys. Basically, pulley are the structures which help in turning the muscle like this. Let's say This is the one muscle belly, and we have to turn the muscle from in this direction. So we turn the muscle. Let's say this, there is a structure present here, a bone. This is the bone. So we need a pulley to attach this so that the muscle can be turned easily. So a structure present here to attach the muscle. This is called pulley. This is muscle which help in turning of the muscle. This is bone. Done. So these are the three structures. So two pulleys, one muscle is omohyoid, omohyoid, and the another structure is another muscle for is digastric. These are the muscle pulleys. Basically, these are the muscles which need pulley. Done. So these are the structures covered by investing layer. Done. So now we are starting the which layer? Carotid sheath. Done. So we are starting the carotid sheath. So these are the things which we have covered. Done. Fascia, investing layer attachment, upper attachment, lower attachment, all these things. Now we are starting the carotid sheath. So again, carotid sheath has one upper attachment and the one is lower attachment. Done. So carotid sheath from the above, it's starting. We know it is related to the carotid artery. So first, carotid artery starting from the which which point? The arch of the aorta. So this fascia started to the arch of aorta. So first, hmm. So first we starting the carotid sheath. Carotid sheath. So again, it is a deep layer, deep cervical fascia. So how it started? Let's say from deep down, we know there is a arch of aorta. First, we write a single point. The sheath, the deep fascia covering which structures? It cover the three structures. So first is carotid artery. Second is internal jugular vein. Remember, obviously the internal jugular vein is internal to carotid sheath, and the external jugular vein is outer to carotid sheath. These are the naming. Internal jugular vein. And the third is important nerve. We have seen the vagus nerve. Nerve. Then we have seen the. So first we draw the attachments. First attachments. attachments. So first, it's starting from the lower part because it is covering the carotid artery. So it starts from the carotid, so arch of aorta. Let's say this is the arch of aorta. This is arch of aorta, and here the carotid artery start. This is the common carotid artery. We know this is the common carotid artery. Then it bifurcates into external and internal carotid. Done like this. It again go above. Supply the external region of the face. External face region. Like facial, eye, facial, nose, facial area, nose, mandibular, all these things. Temporal region, all this. Done. So this fascia present like this. This artery pierces the piercing in this fascia like this. It is a cover again, cover like fashion. Here it start, then it cover the artery. Wait, like this. It covers this area. Done. Now the important thing is there is an important vein come into this. The vein, it again from piercing from the inside this fascia and run in this, running in this between. Done. So this is the vein, internal jugular vein, and the one important nerve between these, the vein and the artery, which go deep down, the vagus nerve. So these are the three things in the carotid sheath. We can name, we name both depending on the section we have taken in transfer section. So we can say the carotid, internal carotid and the common carotid. Internal carotid or common carotid, not and, because only one present depending on section, or common carotid, common carotid artery. Then this is internal jugular vein, and this is vagus nerve. Then this is the lower attachment. So we can write this is the lower attachment. Hmm. This is the lower attachment. Vagus nerve. is lower. And the upper attachment we have seen, the upper attachment is like this. Upper. So this is the skull lower region. Remember this artery, carotid artery and internal jugular vein go inside the skull. So from it enters to the different openings present in the basilar part of the skull. So there are openings present in the skull. So first we only mark two openings, 1 and 2. So first this is the jugular foramen for internal jugular artery, jugular foramen, jugular vein, so internal jugular vein. And there is one again opening called carotid foramen, carotid canal. Done. So these are the two openings here. You can write here. Carotid, carotid artery, carotid canal for carotid artery. These are the two things. We can zoom it for this moment like this. So these are the two openings. This is the styloid process. We can name it. This is styloid process. Styloid process. It is like very pointed. This is the styloid process, very pointing. Then, and the another thing is this is the mastoid process. We can name it mastoid process. We don't only write something. This is the mastoid process, styloid process, internal jugular foramen. Jugular foramen, we can write jugular foramen, and this is the carotid canal. These are the carotid canal. We don't only write, we write only these things. There are many things present here, just three things left. This is related to the foramen. We know this is the large opening called foramen magnum. These are the occipital condyles, just lateral to occipital condyle. This is the jugular foramen, and the just anterior to jugular foramen there is a canal called carotid canal. Then remember this. Remember these two things. Then so these are the upper attachment of carotid sheath. So this fascia covers it. So this fascia attached here like this. It covers these two openings. Cover these two openings like this. Cover these two openings and go descend to the arch of aorta. Then it go like this. Let's say we can draw a diagram. This is the skull region. Again we draw a skull, small here. We can draw skull. Let's say this is the skull region. This is the mastoid process and this is the styloid process. This is the tympanic canal. Done. Done. This is the skull. Just don't mind it. Hmm. This is the skull region. Done. This is skull region. Here is orbit. So this canal present like this. Here is the opening. These are the two openings present near this. So this fascia starting from here and then go deep down to arch of aorta. Here is arch of aorta present. And here is internal carotid and many things. Go. Done. So this is the pattern. How carotid sheath arrange. Arch of of aorta, base of skull में we know at which point it attaches. Done. This is carotid sheath. How carotid sheath attaches. Carotid sheath. So now come to the relations of carotid sheath. Relations of carotid sheath. So first, how carotid sheath made. So first we draw sheath. Let's say this is the sheath. Remember, this is the superficial type. This is the sheath of the which side? We can say this is the anterior portion. Let's say this is the anterior. This posterior. So this is left side sheath. This is left. Superficial. The more is the left thing, more is superficial. Then we know the arteries are deep and the vein are superficial. So first we draw the internal jugular vein. Then we draw the vagus nerve between them, and then we draw the carotid artery, internal carotid or common carotid, depending. Then these are the three things: internal jugular vein, common carotid artery, and vagus nerve. Done. These are the three things. But our main focus is not these three things. Remember, our main focus the relations of this. So for relations, anterior to it, there is a nerve loop present which is called ansa cervicalis. We have covered this later. Some things we understand later. There's a loop present here anterior to it which is called ansa cervicalis. It is a loop of nerve. Ansa cervicalis. This is the loop. So it has two ends. One, let's say it is like this. So we cut this loop like this section. If so, we have two points. They are 2 points of the loop. Ansa cervicalis, it is a nerve loop. Supply the muscles, strap muscles. Then, and the one important thing is posterior to it. One important posterior thing is present, which is called sympathetic chain. This is sympathetic chain. Sympathetic chain. So this is posterior relation. This is posterior relation of carotid sheath, and this is anterior relation. Done. This anterior relation, and this is the posterior relations of carotid sheath. Now we move again. The next point is, so we have covered all another thing. Now we cover the spaces, another spaces formed between these two things. So first, spaces between prevertebral, vertebral, and pretracheal fascia. There are spaces formed in between them. So we again draw a diagram. Let's say this is the vertebra. Again, these are three muscles. We only name just spaces, not all things. Done. The covering is prevertebral. Then in front, we know there is a esophagus present. It is covered by buccopharengeal fascia. Then there are two spaces formed here. The one space is this. The one space is this, and there is one another space formed here. This space. There are two spaces. The first, this space is present behind the buccopharyngeal, so it is called retropharyngeal space. Retropharyngeal space. And there is another space which is present in front of vertebra, so this is called prevertebral space. Prevertebral space. Done. So these are two spaces present. So first again we draw a section. To understand this, we draw a longitudinal section. Done. So first We draw vertebrae, lines. This is the longitudinal section. These are cervical vertebrae and these are thoracic region vertebra. Because these fascia extend till coccyx region, sacral region. These two fascias. Done. So how it extends? So first, these are the vertebrae. So in front of vertebra, one remember there is a ligament present in front of vertebra which is called anterior longitudinal ligament. This is the ligament, not fascia. This is ligament attaches to the muscle. The next is in vertebra there is a fascia which is called prevertebral fascia. Now we draw the prevertebral fascia. This is the prevertebral fascia. This is a thick fascia. We draw thick. This is prevertebral. It descends. This is cervical. This is T1 vertebra. This T1, T2, and T3. Now we draw the prevertebral fascia. This is the prevertebral fascia. Continuous. Continuation. Now again there is a space present. This is the retropharyngeal space and there is esophagus. We draw and the fascia is called buccopharengeal. We draw buccopharyngeal fascia. This is buccopharyngeal fascia. And here is pharynx in front of this. Pharynx is pharynx. This is pharynx. Esophagus, pharynx. Done. So first we named it. These are vertebrae, basically cervical, thoracic, all this. Vertebrae. This fascia attaches to the some thoracic vertebra T1, T2, T3, and it continues down. Done. This is prevertebral fascia. This is buccopharyngeal fascia and spaces. So first, this is this space. These long space. These space. And these space. There are two spaces formed here. So first, this space, this space is called prevertebral space. Prevertebral space, and this space is called retropharyngeal because it is behind the pharynx. Retropharyngeal space. Then, so how it named? Then retropharyngeal. These are the two spaces. Now, one important thing. This hole is not the retropharyngeal space. There is a layer present between the pretracheal and prevertebral fascia. The anterior layer of prevertebral fascia. There is another layer of prevertebral fascia present like this, which join with buccopharengeal. This layer is called LR layer, LR fascia. We write it LR fascia. Basically, anterior layer of prevertebral fascia. Then LR layer. So this space is called this is called retropharyngeal space. Here there are two spaces formed here. The one is this space is retropharyngeal, done, and there is another space formed here. Hmm. So these are the two spaces. This is the alar fascia, anterior layer of prevertebral fascia. Anterior to alar fascia, this is called the retropharyngeal space, and there is another space formed between the prevertebral fascia posterior layer and the alar fascia. This space is called, we can write, this space is called danger space. नाम इसका danger space है, danger space. Why? Because any infection in this fascia, any infection in this space can deep down to the lower region and can infect many things. Esophagus also infected through this fascia, this in space. Here is clinical point, danger space. Clinical point, danger space. Danger space. Which layer give? It is formed in between which layers? Alar fascia and prevertebral fascia. That, so first how it role has a role. Any infection in this area can go down also, down also, and can affect esophagus and trachea. So we have both problems. Problem in deglutition, basically सटकने में, and problem in respiration. This both problems we can face. Result, we have, due to this, so we have both problem and pain in swallowing, swallowing and breathing, because both are affected. Trachea bhi, esophagus bhi. So this is the clinical point. Both are affected in this danger space. Then, which is called, now this khatam. So this is the, in which is called danger space. So this is the important point about the danger space. So this is our fascia of the neck. Whole things we have covered. Then all points. Carotid sheath. Remember, all parts are important. One thing we can add is that the carotid sheath is formed by combinations of three fascia, because all are sheath. So first it has combination of this fascia. It is formed by combination of the three fascias. It has combination of pretracheal fascia and investing layer combination, and it has combination from the buccopharengeal fascia. It is formed by combination of these three fascias. Then, and some contribution from this also. Both form, all these form the carotid sheath. Then, so these again important point you can write in carotid sheath. space here, formed by co- contribution of all layers, investing, pretracheal, prevertebral, and buccopharengeal. Done. So this is again important point. All these form the fascia. So this is different from the done. So this is our complete section of carotid sheath. Done. So next time we starting the again different. So we go in head and neck. We go from superficial to depth. Now, last time we have covered the scalp. Now we have covered the neck. Now again next time we go to the through the face, and then we start the deep structures of the head and neck. Thank you.